All right, Leslie, we are officially now live with Champions for Drug Free Carroll County. Yay! This is our very first virtual meeting with Champions for Drug Free Carroll County. So we did just want to thank you for joining us and being our guest today. And go ahead and just give everybody a second to hop on and let us know you're here. Put a little comment in the comment section and say, hey, and let us know that you can see and hear us both. So my name's Haley Franklin. I am the chair of Champions for Drug Free Carroll County, and I'm honored to hold that position. I'm also with the Kentucky Career Center. That is my job here in Carroll County, and just wear a couple of other different hats, but I'm happy and honored to be here and be a part of this group for so many years. And Miss Leslie Yoakum here is with us. She's our lovely guest. She is the program director of Empowered Living, and that's in Carroll County. And she's going to give us a little bit more information here in just a minute about the programs and services that they offer. For those of you that don't know, they're located right off of Park Lane Shopping Center off of Highland Avenue. And they offer some really great things. So we're going to talk a little bit about the mental health and the substance abuse piece, how they're connected. For those of you that are interested, that's what we will be talking about today. I did just want to go over really quickly before we let Leslie take it away, a couple of business items that we have for Champions. And since this is our first virtual meeting, I don't want to approve any minutes or anything like that. We'll wait till we meet in person to do that. But I did just want to mention first that Wiki Radio has asked us to sponsor the champion of the game. And that's their, hi, everybody. Hi, Donnie. Hi, Danny. Thank you guys for tuning in. We're going to get started in just a second. I did just want to mention the Wiki Radio has requested that we sponsor an event, and it's called the Champion of the Game. It's for the football games, and it runs for 3 months. We would get some great advertising out of that, and it would be $885 for those 3 months. And so if you are for that or if you're opposed to that, just let me know. We'll vote on that later on, but I did just want to put that in your brain for now to start off. And like I said, we'll be approving minutes in person next time we meet. And then please comment if you are watching. Let us know that you're here. I'm going to use that as the sign-in sheet, the virtual sign-in sheet. And I'll make sure to note that you guys are here and listening. So without further ado, Miss Leslie Yoakum is here with us. She's our guest with Empowered Living. And I want her to basically take it away and tell us a little bit about Empowered Living and what they do and what they offer. So Miss Leslie, thank you. Take it away.
Yes, thank you for asking me to do this today. I've been looking forward to it. Connecting resources in the community is so important. So my name is Leslie Yoakum. Once again, I'm a nurse and a program director for Empowered Living, which is an outpatient program primarily at Carroll County Memorial Hospital. I am a nurse, like I said, foremost. I've been with Carroll County for 10 years and always had a passion for mental health. Since working in this program the last 7 years, substance abuse maintains and continues and is an issue that I hear everywhere I go. And so the hospital, we came up with an idea that I'm excited about. We've been doing since December. It's called medical stabilization. And essentially it's detox. Those are words that you hear more often in this field. But medical stabilization is what we do in a hospital setting where we manage the withdrawal. So we can admit people to the hospital. They have been 8 to 12 hours sober. They're not feeling well at all. Their heart rate's up. They're nauseous. They're vomiting. They're sweating, a variety of symptoms, just anxious, maybe lethargic. They come to us. Instead of going to the ER, you can call the phone number. It's below. And if no one answers, there's actually an emergency number as well. So 24 hours a day, 7 days a week, you can get a hold of somebody. And we can actually directly admit you, bypassing the ER if you meet qualifications. And we can take care of you and make sure that you feel better, and not necessarily perfect, but that you feel better and that you stay encouraged and motivated, and that you sort of begin this road of recovery, whether it's the first time or the 100th time, with empowered living. And we will work on establishing the outpatient or inpatient rehab while you're in. So I don't know if anyone has experienced this themselves or if a loved one has, but you say, I want to be sober, and then it's a wait. It's a process. You don't know where to start, depending on whether you have insurance or not. Lots of, whether you have a ride, a transportation, lots of barriers prevent that. And so by coming to the hospital and being medically managed, monitored by 24/7 staff through your withdrawal process, we can, during that time, find the appropriate outpatient or inpatient rehab for you following that stay. So what that does is hopefully get you motivated, helps you through the hardest of the time, that gets you to that next step. And then going forward, we'll follow you. We have a great team of therapists, a doctor that can help manage you furthermore. So we are so excited to be doing that. We've had some great success stories. We've already had folks come back and say, I'm 6 months sober, I'm 7 months sober. It's a trial. We've had people come back again. So we understand that it's not a punitive thing. We just want to make sure that it's the best fit for you. So please, please, please call that phone number. Even if you are not yet sober, you're thinking about it, call us. We'll say, this is what this is going to look like. Yes, you do have to be in withdrawal to be admitted. But let's talk about what those symptoms are, because a lot of people don't realize that they can get in and they're having a withdrawal symptom, and we can get them inpatient. We can get them comfortable before they're so uncomfortable that they just feel like they can't prevent using, and that they can't wait. So get involved with us as soon as possible. Make that phone call and let's get you taken care of. Like I said, we have a team of people that are going to be working with you. Nurses on the floor, doctors on the floor here in the hospital in Carrollton, and then a whole team of staff that's working to make sure, if it's housing, if it's a phone, if it's food, if it's your children, anything we can do, we're going to try to manage and make phone calls on behalf of you, letters on behalf of you. I've worked with the county attorney's office. People are like, I can't come, I have court next week. You can. They will work with you. We work well with Carroll County, but we've had to call Kenton County. If they know that you're in a facility, they will push that court date back, and it's going to do nothing but help you. So I think that's a big barrier, is I have all these important dates coming up. People want you healthy. So please just call and we will work out those barriers together. Another issue is transportation, and Carroll County Wellness Transit is here and available and will help anyway get you to that next step, or even get you into our office to begin with. That being said, I want to kind of backtrack a little bit and let you know that we do have an outpatient program. We're working on credentialing. Inpatient, we can pretty much see anybody and everybody. If you don't have insurance, we will work on getting that established, and you're more than likely going to be able to stay here with us at the hospital. On the outpatient side, we can see currently traditional Medicare and traditional Medicaid. And we're working on getting credentialed with other payers, but regardless, we've been able to Zoom with the Brook right from our location. So those folks still can come into the office, and we can set them up with the media necessary to do Zoom IOP. We will transport you, if there's no other option, to whatever service we can find. There is yet to be an individual come in, and I'm talking, we're new, say 50 folks, that there's not been something that we find for them that we can help get them to. And all you have to do is say yes, say yes to a positive lifestyle with Champions. It's saying yes. It's true. Just say yes to the resources that are here in the county, because they're there. We need to talk about them. We need to work together, and we need to connect people with getting their lives back together.
Absolutely. And I love that you mentioned connections in the county and in the community. while I'm here, I wanted to mention, with the Kentucky Career Center too, we have a great program where we help people find jobs. And that can be with any second chance employer that we work with, people that you work with. We can connect them to a good job if they're struggling and needing that too. So just keep that in mind too, everybody out there listening. We are here to help, so we love the connections. I did want to take this moment to tell everybody that's listening to please ask any questions that you might have for Leslie. We're going to use this as a sort of interactive virtual meeting. So if you're just now tuning in, if you have questions, please put them in the comments section and let us know what your questions are, and we will definitely try to get to those and get those answered for you. Sorry to interrupt, Leslie. I just had to get those things out there. I'm like super passionate about just utilizing the connections that we already have in the community.
Absolutely. Like I'm second chance employers. I want to know about them because I know some, but it's those little details that make the biggest difference for folks.
Yeah.
It's the hope that they're going to get through this and they're going to have a job. They're going to have access to the resources they need, like shelter, when they're done with this, because sometimes they just don't know.
Absolutely. So now that we're here, does anybody have any questions that they have just offhand? I see North Key is here. Thank you guys for being available and being here with us. Danny Osborne is here. He's the superintendent of Carroll County Schools. Thank you for attending. We have Kathy McBurney. She's our treasurer with Champions for Drug Free Carroll County. So we normally have, when we have these meetings, we are obviously pretty much in a room where we can go around and just introduce ourselves and who we're with. So I'm trying to take a second to pull some people out that I see that I can introduce. Delane Delahanty is here. She is a dedicated community member, wears many hats in this community. She's with the Clothing Closet and just a few different other things, AA and Associates. And she's just a dedicated community member, a parent and a grandparent, and a great family member. So thank you guys for tuning in here with us today.
And Delane has actually brought us an individual or two maybe already, and so that's another form, is just communication. So if anybody has questions about how that process worked for people that she cares about, then I'm sure she would love to share.
Yes, that's amazing. I did not know that. Thank you, Delane. Kathy McBurney says, excited to hear about the transportation. Can you go into that a little bit deeper for us?
Yes. Carroll County Wellness Transit has sort of just evolved over time. The county actually received a grant and didn't really know where to put it into use. And as the outpatient mental health facility that we are, transportation was a barrier, and Ruth Baxter connected us with that grant. Since then, the hospital manages it on its own, and we have been blessed with federal dollars and with the donated vehicles. And so we have 4 vehicles at this time, 2 drivers. We're Monday through Friday to noon, Monday through Friday 8 to 4, and then Friday is 8 to noon, but we will be available to those outside of those hours if we can. And oftentimes we can meet that need as long as it's scheduled. We do ask for a 72-hour appointment, and that's just to make sure we have the staff and everything here to provide you your trip. Another thing, though, is, if you're getting out of the hospital, if you went to the ER and by ambulance and you need to go back home, that's something that sometimes happens in a little less notice, or you admitted to the hospital, you can't get home. You have to go to a test. So sometimes people will go to, say, cardiac rehab, and they want you to go to Louisville to get something further done. Call us. A lot of the facilities know about us, the health department, the doctor's offices, but it's just the individuals where your doctor ordered an MRI and you think, how am I going to get to that? Call us and we will work it out. David Harney is our transit supervisor, and he works really hard at making sure that he's available or make somebody available to make sure that your healthcare needs are met. We'll also take you, to the pharmacy. So that seems to be a big one too. So you've done all this virtual medicine these days with primary care doctors, but you still need to get to the pharmacy to get that taken care of. And we'll work with you on just making sure all of your wellness. We've even taken people to GED classes. So with COVID, we're a little bit more narrowed on what we can do with one person per the vehicle at the same time, and we can't have a lot of personal belongings in the vehicle. But for the most part, we're able to get you anywhere that you need that is to promote a healthy lifestyle.
That's amazing. So I think you answered this, but Delane popped up and has a question. Do you take people to doctor's appointments? You said you can, right?
Absolutely. So Empowered Living is where the grant started, but for 5 years, we take people. You do not have to be a patient of ours. This is free, to the community. At this time, God has blessed us, to allow it to be free because the federal dollars, I'll just be honest, matches us at 50%. And the hospital has agreed up and through this fiscal year to continue to provide us with that 50% match. And we've had some donations from the public, and we've had some donations of vehicles. So far, it is free. It is at Carroll County. I try to keep it Carroll County resident, Carroll County focused, but we'll take you to Louisville. We will take you anywhere. We've taken people to Shelbyville. I say anywhere, but wherever that specialist appointment or that test that you need done. I mean, even another example is the family court has needed some testing done on some kiddos, and mom just doesn't have a ride. We've taken a whole family to get that testing done at U of L. So outside of the box, if somebody's in a crunch with transportation, call us.
Wonderful. I am going to try really hard not to bounce around this virtual meeting. But as people come in and comment and remind me things, I will try to stay on track here. So, Delane, thank you for that question. We hope that we answered it for you. Donnie Dawes is watching. He is here, and he wears probably 150 hats in this community. So we are proud of Donnie and happy that he's here watching with us. He says his new position is with NKU COPE, and that's a new federal grant that we just got in conjunction with Owen County. And he is the Grant County, Carroll County Reentry Specialist. And he says that Yvonne Poe is the COPE coordinator for Carroll County. So that's pretty awesome. One day we will probably have to utilize one entire meeting to talk about the COPE.
I was going to say I'm actually excited because I'm already working with them, and there's all kinds of exciting things. So one thing I want to share that I feel like is directly related to medical stabilization is one of our success stories is going to be, and then this grant is what brought it to his attention, working to get his peer support specialist education certification through NKU. And so it's stuff like that we talked about, like second chance employers, getting certified as a peer support specialist, that we work together and we get people the hope, the future, the drive, the motivation, the encouragement that, sometimes your addiction is actually necessary for a position. And something like a peer support specialist is the exact place where people are needed desperately. And unless you have that experience, you're really not qualified. So instead of that past being such a burden on your back, it can be a blessing to another person that you help pull out of that place. And so I want to thank the COPE grant already. They just started, but I want to thank them already for helping some folks that I care about get encouraged for their future.
Yes, absolutely. It's an amazing opportunity for Carroll and Owen County. So I'm honored to just be a part of Champions and with so many other connections, even Empowered Living, that we have the opportunity to work together to help with this epidemic. So thank you, Donnie, for your new role with that. And he's also with Carrollton Ministries, and he has some other things up his sleeve that he can help the community members with as well. We do have Nancy Costello here. Nancy, thank you so much for joining us today. She is actually the program director at NKU, and she knows all about COPE. She's helped, I believe, write the grant and kind of just take it and run with it. So we're happy to have her on. And she says, the COPE grant is helping to promote transportation, the transportation program piece. There are business cards that Leslie has if anybody wants to help advertise. So go by and see Leslie when you can, get those business cards, and make sure to hand those out to as many people as you can.
And late in the News Democrat, we had a great full-page ad with our drivers, and it tells a little bit about the expectations and what we're doing to keep people safe during COVID. So I think, once again, the COPE grant, they've done so much, I just forget. They have been supporting us from the beginning, and I really appreciate Nancy and all that team has done.
That's amazing. Thank you. Thank you. We appreciate it as well. Happy to be a partner with that. Let's see. Delane says Donnie needs to be next month's speaker. We might have him do that, Delane. And while we're talking about that, October, we will have a guest speaker from the Women's Crisis Center. There will be a new Carroll County advocate from there, and we'll have representatives from the region come and speak. So mark that in your calendar for October. The fourth Thursday at 11:30, we'll have the Women's Crisis Center. And we just might have Donnie come speak next month if he's up for it. All right. Let's pull out any other questions. Oh, here we go. So Kathy McBurney is our treasurer, and she wanted me to mention our two seniors that just graduated, Carroll County High School 2020. Congratulations to them. It's Miss Lorinda Bennett and Christian Lilly. They were our female and male representatives for last year. Due to COVID, obviously it got cut short a little bit for them, but we did honor them with a certificate and a $250 scholarship. So they had that, and we received a thank you card, and we're just very honored to have them on board with us for the year, and we wish them all the best. So thank you guys, and thanks for reminding me, Kathy. I appreciate it. Any other questions for Leslie right now? You guys don't forget, let me know you're here in the comment section, and let me know if you have any questions whatsoever. This video is being recorded, so we'll be able to share it out to anybody that missed it. And if they have questions, we'll make sure they get answered as well. So, Donnie, thank you for your support. We appreciate you always. All right, Leslie, you talked about the transportation. Give us just a little bit more insight on just different programs that you guys offer. I know you talked a little bit about it in the beginning in the stabilization, but anything else that you want to outline?
Yes. So our biggest focus is intensive outpatient therapy. So right now, like I said, we service Medicare and Medicaid. With the medical stabilization, we have been having a greater focus on dual diagnosis, which is both depression, anxiety, or dual mental health issue as well as a substance abuse issue. So we have a great couple of groups going. We have 4 therapists. We do individual counseling, family. We do psychiatric evaluations. We have a phenomenal doctor. Her name's Sudha Patel. She comes to us virtually, but she does a great job. People feel super comfortable with her. I'm so thankful for her involvement in our program. So that's pretty much what we do on a day in and day out, is group, individual, and family therapy on the intensive outpatient basis. And then we just help people step down to whatever it is that they need moving forward, whether it's involved in AA, a church group, the senior center. Obviously, all of these things have changed a lot for us recently, but typically our goal is to get them in the right direction, remain a support for them, and then normally they spend 6 months to even a year kind of getting rehabilitated mentally and emotionally until they're able to be self-sufficient, and they've developed new social and financial supports that keep them successful. And sometimes they come back as well. But this is typically and originally was people with mood disorders, whether it be schizophrenia, bipolar, debilitating depression, PTSD, anxiety, and then obviously substance abuse trickles in along the way. And so
Right.
now we're thankful that we can admit someone into the hospital, help them through that process, and then just kind of work on the whole of it. But one thing I want people to see empowered living as, more importantly, is kind of like a mental health substance abuse triage location. Everybody's flooded and busy, but you can call here, and no matter who your insurer is, we're going to guide you in the right direction. We might not be able to provide your care, but I just have seen so many times making that phone call. So for instance, calling Northkey, they have great services, they have great things to do, but you got to make that phone call. And if you need help with that phone call, like, we'll come and we will make that phone call together in my office and get you established. And sometimes the smallest first step is the most difficult one to make. So call us no matter what, and we will get you in the right direction.
That's amazing, Leslie. Thank you. And it's scary. It is scary to take that step and to ask for help. And a lot of people, that scares them. So just being there and being a human and being a voice for them is, it makes all the difference. It really does. So,
and I saw Donnie down there. He said, mention Life in Carrollton. So he's going to have me after this meeting if I don't. So yes, we even have people that work with Life in Carrollton in conjunction with us. So we're partners with Life in Carrollton. Donnie does a ton of different services on the outpatient side with substance abuse and mental health. And I want everyone to know that coming to empowered living doesn't mean that you necessarily have to let go. I mean, obviously you wouldn't want 2 psychiatrists or 2 clinical therapists, but we just want to be a piece of the puzzle. And so we kind of fit you in, and along the way, we'll fit you in with groups like Life in Carrollton and make sure that spiritually, mentally, emotionally, all of those things that people, it takes a village. They joke that it takes a village to raise a kid. It takes a village to raise adults. I mean, we all need that village. And so I'm so thankful. Carrollton has it all. We just need to connect it.
That's right. I totally agree. Thank you, Donnie. Before we go, because I know it's been about 25 minutes, and I know that people's attention spans are like a goldfish. So I'm right there with you. I wanted to thank just a couple people for hopping on. Carolyn Jones, she's been a couple different roles with us. She's with the school board, and we thank her for her dedication, and you're welcome for the scholarships for the students. We're honored to do it. Which reminds me, we will have to choose 2 more students to represent our 2021 school year. So if you guys have any recommendations for that, they'll have to just write a short little essay to us, to Champions Coalition, and tell us why they would like to be a representative. And then we will choose a female and a male student to join us. I think that was everybody. Danny said squirrel. Yes. Those are the attention spans that I have. So thank you guys so much for joining us today. And like I said, if you have any other questions, please put them in the comment section and we will get them answered for you. I will send this video out once it's been published. It is being recorded. And, I did also want to thank, where did she go? Stephanie O'Neill for hopping on with us. She's our secretary for Champions for Drug Free Carroll County, and she has been awesome throughout the years, always taking our minutes and just being a big supporter of Champions. So we thank you as well, Stephanie. And Larry McNabb, yes. So Larry is with the Kentucky Career Center through Brighton Center as well, and he wears a couple different hats. And he wants us to remember that September is National Suicide Prevention Month. So that's a big correlation between both of our entities here. And we did just want to remind everybody of that. And Larry, if you have any links or anything you want to put in the comment section there, feel free to do that so folks can view that as well. Leslie, did you have anything else you wanted to add before we hop off of here?
Well, I did want to. He reminded me of our suicide prevention walk. It's going to look a lot different this year. So I don't have the details I can't share with you, but just to kind of jog your memory, reach out to folks, Holly Dawson, and others that are participating in that walk to see how this year's walk will go on. It'll look different, and we're excited about those changes. So just be looking forward to being involved this year with the Carroll County Out of the Darkness Walk.
Wonderful. Thank you. All right. And those business cards that you have, Leslie, make sure you give me a couple of those or maybe scan them to me.
Yeah.
I'll turn it into an image and we can put it on our Facebook page.
Absolutely. Yes. Thanks again to NKU and the COPE grant.
Yes, absolutely. Thank you so much, Nancy and NKU and the COPE grant. We'll talk more about that probably next month if Donnie is down to be our guest speaker for that. I'm putting him on the spot, so maybe he'll be more inclined to say yes. And thank you guys so much for tuning in, being a part of our coalition. And if we do decide to meet next month in person, I'll email the distribution list and let you guys know. So thank you all so much. Have a great day. And thank you, Leslie, and Empowered Living and all that you've done. We very much appreciate you.
Thank you.
Thank you. Thank you. Have a great day.